that are relevant, that each of which has a designated contact that is available and are part of that coordination effort. We've used that plan in the past, as I've indicated, for natural disasters, and that coordinated response will be ready for when there are any diagnosed cases of coronavirus here in the state. When we say the State Emergency Operations Plan, it's important to talk about what that means and the components of that. First, we opened something called the EOC, the Emergency Operations Center. That's our specialized unit that we've used, as I indicated, 5 times during my governorship and a couple dozen times in the prior administration to lead the response to situations. Again, often they are natural disasters. They can also be this kind of event or other kinds of disasters as well. Mike Willis, who you'll hear from, will lead the EOC in his capacity as the director of the Colorado Emergency Management Office, and he has my full confidence with his demonstrated ability to get that done. The plan directs state agencies to identify and activate their staff members that are diverted from their regular duties in order to be available for preparation, right? So again, including 24-hour designated folks who are available. We've directed state agencies to review their plans for continuity of operations, how they can ensure that core functionality continues to occur in the cases where employees are detailed to the Emergency Operations Center. Our plan also contains a highly infectious disease response annex that's in place for a variety of potential diseases that will be detailed to this. I'm also grateful that as governor, we have a 19-member committee called the Governor's Expert Emergency Epidemic Response Committee. We call it the GERC. That's the acronym, but it stands for Governor's Expert Emergency Epidemic Response Committee, that advises me on our response. The membership of the GERC has really critical expertise in areas relating to health and disease and public safety. It includes folks like the president of the Board of Health, the State Medical Society, the Colorado Health and Hospital Association, a number of folks involved with medical technology and response. And the GERC is the policy body that advises me on critical policy decisions on how we can best use executive authority to protect the public. They are some of the most knowledgeable people in the state on this topic, and I want to thank those who serve on our Expert Emergency Epidemic Response Committee for their help and guidance in this area. Their work is absolutely critical, includes a number of folks, including our Chief Medical Officer for the state, Dr. Eric France, including the Chair of the State Board of Health, Rick Brown, including Dr. John Carver, Dr. Mark Johnson, and many others that will help coordinate this response based on whatever occurs here in Colorado. Based on how things progress, additional steps may be needed beyond the implementation of the State Emergency Operations Plan. Again, that's the first step that provides for the interagency coordination. But under the Colorado Disaster Emergency Act, the governor would be granted a wide range of options to protect the public. And if needed, we won't hesitate to use them if the situation worsens and if these powers are warranted. So under, again, if there is a declared emergency, as the state has had, for instance, in recent history for fires, there are additional authority that would reside with the GERC and with the governor to contain that epidemic. And I would not hesitate to use them if warranted in conjunction with our advisory committee. I also want to let you know we're in constant contact with our federal partners on this matter, as well as our local departments of public health at the county level. Yesterday, we had a call with the Vice President. I made 2 specific requests, Vice President Pence. First, I requested funding for a staffing surge. That means lab personnel, epidemiologists, emergency responders, and others to expand our state capacity. Second, I requested funding for our preparedness grants that are administered through the Department of Health, that they waive the grant application requirement to cut through the red tape and provide provisional approval and paper those grants later to deploy existing resources rather than bog state personnel down in paperwork during a time when we need all hands on deck. I also had a call with our congressional delegation where I supported their efforts to pass a supplemental that would help provide resources to states, including Colorado, to help prevent these outbreaks. Now, I know While I'm, of course, going to be doing what we can to keep people safe, it's also important that we share information about the best practices that every Colorado resident should do to avoid catching coronavirus or any other communicable disease, including the flu. This is, of course, flu season. There's no current vaccine to protect people from coronavirus. That research is underway, but there is no vaccine. But there are some important suggestions from the CDC to protect yourself, and that means avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth, staying home from work when you're sick and keeping your children out of school when they're sick, covering a cough or sneeze with the tissue and throwing the tissue in the trash, and cleaning and disinfecting frequently touched objects and surfaces on a regular basis. It's also critically important to wash your hands regularly with soap and water for a full 20 seconds. And that's longer than most people wash their hands. Sometimes you just put them under the water quickly and take them out. But use soap, wash thoroughly for 20 seconds, and rinse. And that means after going to the bathroom, before eating, after blowing your nose, after coughing, after sneezing, and just in general. In addition to the soap and water, or if they're not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. But in the meantime, Coloradans should continue their normal daily routine. There's no diagnosed cases in Colorado. I want to state that there is no identity or community or ethnic or racial group that is more at risk for getting coronavirus than any other group. I also know that we're likely to get questions in terms of supplies. Coloradans, as they would before a blizzard or other event, and it's always good to have at least 72 hours worth of food and water on hand in your home. That's a best practice that Coloradans should do, and this is a good opportunity to make sure that you have at least 72 hours of food and supplies in your home. That's a standard that residents of Colorado should always meet for whatever nature throws our way. We have in Colorado about 650,000 N95 masks in the possession of the state. Those would be distributed, if needed, to caregivers and those at risk. That is in addition to the private supply, meaning there are many hospitals, and we don't necessarily have all the numbers of N95 masks that our hospitals would have, but the state itself is in possession of 650,000 that we have a plan to deploy if and when needed. We also now have the state capacity to test 160 people per day for coronavirus. We expect that over time that capacity will increase. In the meantime, we've expanded the initial CDC parameters for testing to a broader group than just those who have recently been traveling in China or countries that have been affected. So that increases the likelihood that we would be successfully able to diagnose a coronavirus case here in Colorado. And in the likelihood that that does occur, we feel that we will be prepared at the state level to address that. I now want to turn it over to Mike Willis, our director of the Colorado Office of Emergency Management, to talk about some of their work, and then we'll go to Jill Hunsaker-Ryan and Dr. Rachel Herlihy, and then we'll open it for questions. Mike?
Thank you, Governor. Good morning, ladies and gentlemen. Governor Polis's activation of the State Emergency Operations Plan is an important step in ensuring coordination and unity of effort across all of the state departments and agencies involved in COVID-19. While the governor has appropriately not declared a state of emergency, this step is an important step in ensuring a coordinated approach for preparing for this potential threat. The state's Emergency Operations Center implements the plan on behalf of the governor. The center actually operates every day and is prepared, as the governor described, to respond to any incident or any hazard that may affect the state. So this is sort of routine business for us, except that we have now elevated our operations to include 10 other state agencies. The state's Emergency Operations Center is the central point of coordination for departments and agencies of the state in order to ensure efficient and unified effort from state government. It facilitates coordination and communication between state and local authorities and between the federal government, and it provides situational awareness to the governor and to his cabinet. While the center has been coordinating with the Colorado Department of Public Health since the beginning of January in response to COVID-19, we are now elevated our operations to its second highest level. As I said, 10 state agencies are now engaged, operating from the State's Emergency Operations Center, and we'll add more if the situation warrants. Beginning Wednesday, tomorrow, we'll also integrate a coordination team from FEMA into our operations center as this situation continues to evolve. Thank you, and I'll be followed by Dr. Hunsinger-Ryan.
Good morning. The Colorado Department of Public Health and Environment has been planning a novel coronavirus, also known as COVID-19 response, for several weeks now. The United States has a highly sophisticated public health system involving the Centers for Disease Control and Prevention, state public health agencies, and local public health agencies, which represent every county in the state. We regularly work together to detect and contain communicable diseases and prevent them from spreading. The Department of Public Health and Environment is coordinating with the healthcare system to prepare for cases in Colorado. And we are actively monitoring the situation through our own state laboratory, which is providing 7-day-a-week testing. While the complete clinical picture with regard to COVID-19 is not fully understood, reported illnesses have ranged from mild to severe, including illnesses resulting in death. However, initial studies indicate that the majority of cases are mild, although people with chronic health conditions can be more at risk for complications from the illness, similar to seasonal flu. While Colorado does not have a reported case, we are seeing increased evidence of community spread in other states. And this means there are cases of infected individuals who did not have relevant travel history or exposure to another known patient with COVID-19. It is possible that mild cases are going undetected by the medical system and spreading to others. If the illness becomes widespread in Colorado, it will be important for individuals to use the same standard precautions that the governor mentioned that we used with any communicable disease. Of particular importance is to stay home when you are sick and to also keep your children home when they are sick as well. It's good now to start making backup plans around working from home or a plan B for childcare if possible. And if that, I would like to turn the mic over to Dr. Rachel Herlihy, state epidemiologist, that will talk more about the virus and its spread.
Thank you and good morning. Since COVID-19 is a new disease and there's more to learn about the virus, the current understanding about how it spreads is largely based on what is known about similar respiratory diseases. To become sick, you have to be exposed to the virus. CDC defines exposure as being within 6 feet, approximately 2 meters, of someone with a confirmed infection for a prolonged period of time. Exposure can occur through respiratory droplets, when an infected person coughs or sneezes, similar to how flu and other respiratory viruses spread. It may be possible to get COVID-19 by touching a surface or object that has the virus on it, and then touching a person's own mouth, nose, or possibly their eyes. Symptoms of COVID-19 include fever, cough, and shortness of breath. While the illness can be severe and require hospitalization, most individuals recover by resting, drinking plenty of fluids, and taking pain and fever-reducing medications. In most cases, approximately 80%, we expect the symptoms to be mild. This is why we advise everyone to stay home if they are sick, even if symptoms are mild, because the severity of symptoms varies. If you did not have a high risk of exposure, meaning that you didn't travel to an affected area recently or were recently exposed to someone with the virus, it is unlikely you have COVID-19. But if you are experiencing symptoms and are concerned, contact your healthcare provider or a nurse line service. It is important to call ahead before going to see a doctor or to an emergency room. Tell them your symptoms and that you suspect you were exposed to someone with COVID-19 or had recent travel to an area that is experiencing community spread. Many people have asked how we handle suspected cases, so I want to provide a step-by-step overview. So first, we get notified by a medical provider or local public health agency that we have a suspect case. We then coordinate with the local public health agency to determine the level of exposure the suspect case had. Did the patient travel to China? Has the patient been around someone with the virus? Does the patient exhibit symptoms aligned with what we know about the virus? In coordination with the provider, we determine if the patient needs to be tested. The provider takes specimens, a swab from the patient's nose and mouth, and coordinates with public health to get the specimen tested at the state lab in Lowry. The lab processes the test within about 24 hours of receipt. While we are waiting for test results, we work with the provider to determine if the patient needs to be cared for in the hospital or if symptoms are mild enough for the patient to stay at home following CDC home isolation and monitoring guidance. Local public health, the healthcare provider, and the patient are then notified of the results. If we get a positive result from the lab, it will be deemed a presumptive positive, and we will notify the governor, local public health, and then the press as soon as possible. We will determine if the patient exposed others. For example, if they went to the hospital or a public space, and we will notify people who have been exposed to the best of our ability. Based on their level of exposure, some of those people may be quarantined and monitored for the development of symptoms. Our goal after getting a confirmed case is the same as always, to minimize the spread. These steps will help us do that. Thank you.
Thank you. We'll be happy to take some questions, and I might also refer to some of our other folks up here, Stan Hilke, Public Safety, and others. Questions?
Yeah, there's been reports that people have been billed thousands of dollars for these tests that have been tested in other states. Is the state providing these tests free of charge, or are people, even the uninsured, going to get charged for them?
Hi, my name is Scott Bookman. I'm the director of the State Public Health Lab. I'm also the incident commander for this response for the Department of Public Health and Environment. There is no fee for testing at the state lab or any of the labs that are sent out to the CDC.
Yes.
Yesterday there were 9 pending tests. Do you have the results for those?
Again, if there is a positive test, we will notify the public as soon as is practical about that. As soon as after the patient themselves is provided notice.
Governor, 2 questions. First of all, yesterday, Governor Cuomo in New York did sort of limit co-payments for patients of the state who were showing up at ERs and test results. Is that something that you might consider doing in Colorado? And then my second question is also, how many tests were done over the weekend and yesterday, considering there is a now expanded round of testing that's taking place?
So first of all, the capacity for the 160-day is new. Up until that was in place at the state lab, we had conducted roughly 24 tests, and we were not able to do those in-house in our lab. Now we have that capacity, and we're expecting that we will be doing. Yes, go ahead.
So since January, there were 14 tests done by CDC on Colorado individuals. There have now been 15 tests performed at the CDPHE laboratory, and that's really just since Friday. We have a total of 37 individuals that have been or are being tested. 8 of those are pending right now.
Should the capacity be larger now that we have expanded testing, and should we be doing more testing?
Again, those will be medically indicated. The criteria have been broadened. It's not just people who have returned from China or Rome. It also includes people that might have traveled in areas where there might be a community spread, and others that are suspected reasonably by their practitioner of being a candidate for coronavirus.
Governor, how satisfied are you with the federal response?
Oh, I think you had us really on a second question. So again, it is, to be clear, we make clear there's no charge for any of these tests. They're provided by the state lab. People should not be flocking to the emergency room unless they are in dire need of medical treatment. Again, if you are very ill, you should see your doctor, or if it's urgent, go to the emergency room. But if you have a sniffle or a small cold in Colorado, you should treat that as you normally would, meaning, again, try to avoid contaminating others, avoid going to work. But unless it worsens and this is flu season, this is cold season, so unless the symptoms are severe, you should treat it as you normally would.
Yeah, so how satisfied are you with the federal response, particularly with the testing? There's been talk about not enough tests and not coming online quick enough.
Again, well, we have upgraded our testing capacity here at the Colorado State Lab. Again, we hope that if needed, that can be increased even further. We put in our 2 requests with Vice President Pence yesterday. We look forward to hearing back. We also encourage the delegation to move forward with additional surge resources through a supplemental. I'm confident that will navigate its way through Congress and reach the President's desk in the near future. Well, we're not, again, there's no diagnosed cases of coronavirus yet in our state. We are not seeing greater absenteeism among state workers than we normally would at this time of year. We encourage our state workers, just as private sector workers, when they are ill, we encourage them to stay home.
What are you doing to help schools prepare, including the CDC have recommended schools develop remote learning plans? That's not a capacity that a lot of schools have. What kind of work are you doing to help them?
So in our state, of course, districts are highly autonomous. Some have online and distant learning modules. Some don't. Again, it's absent the use of emergency powers that would occur under a declared emergency. And again, this is not a declared emergency and those powers are not being invoked. Absent that, these decisions are made by school district superintendents about how and when to do their classes. We recently had a school district, Mesa, in Mesa County School District, that closed down for several days due to the rotavirus. It was very effective in allowing an opportunity to prevent the additional spread of that, to clean the schools, and then to reopen without significant additional incidences of the rotavirus.
Governor, you mentioned the number of masks that the state has.
Mm-hmm.
I think you said 650,000
Yeah.
N95 masks.
Mm-hmm.
There's been some discussion among health officials about masks doing more harm than good to people who don't have the virus. Can you speak to that?
Well, I think there are some scams out there that are trying to get Coloradans to spend their hard-earned money on masks that they don't need. I would discourage Coloradans from doing that. Many of those masks being sold are not at spec to even prevent the spread of this virus. Again, those will be deployed where needed to prevent the spread of virus. For those who are medical workers or involved with transporting or feeding those who are affected, we will make sure that they stay safe as well. But again, Coloradans should avoid falling prey to schemes that are designed to prey on our fears.
Governor, if we see a large outbreak in particular areas, would you consider closing towns, as has been done many, many years ago, 1918, guns closed down in 1992 again. Also, prohibiting mass gatherings, do you see that in the future?
So again, all those types of authority resides under the emergency, a declared state of emergency. This is not a declared state of emergency, but those things would be considered in consultation with the GERC if there's a severe outbreak, as those emergency powers could also be authorized if there was a significant forest fire or other natural disaster. We would be very thoughtful, but also decisive about doing what we need to do to keep the people of Colorado safe. And right now, that simply involves sharing public information, increasing testing, promoting best practices and hygiene. That's what we need to do. But if the condition elevates to a level where we need to take more decisive action, we're prepared to do that.
How is Colorado's standard for testing different from CDC's? Is it more restrictive or less restrictive than what
So there are a couple of ways that our testing is different. One, we are testing a broader group of individuals who are not necessarily hospitalized. So currently the CDC recommendation around individuals who have traveled is that those individuals be hospitalized. We are testing a broader group. The other thing that we are doing this week is standing up a Sentinel Surveillance network. So this would be based in facilities around the state to try and get to that unrecognized level of transmission that could be occurring, where we will be routinely testing specimens from patients coming to facilities across the state. So it's going to be based on specimens that test negative for influenza and other respiratory viruses. We will be routinely testing them for novel coronavirus.
So again, that means they would be tested for more likely candidates for their symptoms that they express first. But if those are ruled out, this would be looked at, yeah. as well as continuing, by the way, those who have returned from the travel areas that are at high risk. That will continue as well. It's not one or the other. It's being added on top of the previous criteria. One final question. Is there anybody else who has any questions? Yeah. Again, right now we have no diagnosed cases of coronavirus in Colorado. This is flu season anyway. We always want Coloradans to avoid getting sick where possible. We have some simple suggestions to do that, including washing your hands with soap regularly, not going to work when you're sick, keeping your child home if your child is ill, covering your mouth. These common sense precautions not only will help keep Coloradans safe, but will also help prevent the outbreak of something like coronavirus in our state of Colorado. Thank you.